This is always an intimate, kind of close-knit community. We're having really real conversations, action-oriented conversations. So if you can put your camera on, we would love to see your smiling face or you, whatever state you're in on this day. Hey, Michelle, we're seeing some great folks here. Michelle Drew. Hey, Adrian. Oh, I love it. I love it. Family reunion here. So many great folks here. Shanae. Miss Otto, welcome. If you can, as we're getting started in the next 2 minutes or so, if you can introduce yourself in the chat, please, where you are joining from. If you want to shout out any institutional relationships you have, whatever you want to do that in the chat, and we will get started in a moment of letting people file in for this conversation. Introduce yourself in the chat for anyone who just came. Hello, Faith, welcome. Julie, great seeing you. Coming in from PA. Welcome. We'll get started in a minute or so. Let's do some introduction to the chat. Bay Health representing here. Councilwoman Shanae Darby, Black Mothers in Power. Welcome. I see the Eagle shout out. Yes. Some of us are on cloud 9 right now. Hope that continues. Welcome, Pamela like Pamela. Great seeing you again. All right. All right, welcome to everyone. You can keep the introductions coming in the chat, and Morgan will let anyone else who joins know to do that so we know who's joining us today. As I mentioned before, it's so great to see so many people that I know and some new faces as well for this conversation today. We want to get right into it. I'm Atnre Alleyne. I'm the founder of the Proximity Project. The Proximity Project was started in August of 2020. Here, all these years later, now in January 2025, February 2025, we boast 300, we just crossed 300 alums of the Proximity Project. Many of the alums are here. Shout yourself out in the chat if you did the Proximity Project cohort. For anyone who doesn't know about that program, we started this in August 2020 as a lot of people were having conversations around race and racial justice, trying to create an experience, a community, a cohort, a program that was going to focus on the voices from the community, on getting more proximate to the most marginalized voices. We wanted a different learning experience, right? Not just a kind of one-time come in, do a training in your agency, right? Window dressing sometimes. We really wanted a deep experience where people got into some readings, like the case for reparations, right? Like, a book is here, American Sirens, right? All kinds of other content. And so we started this program. I didn't know if anyone was going to sign up. I was like, maybe 10 people will try it out. And the first group, we had an overwhelming response and continue to do that. So I'm really just grateful to our community here, many of who continue to come back for these other events, for joining the program, for trusting us with your learning journey, right, during that program, and for continuing to tell others about the Proximity Project. Most of the people that join come through word of mouth from people within their organization or outside the organization. So I celebrate all of you. We're in a time right now in the country where there's a lot of rolling back, a lot of people retreating, a lot of people in fear around racial justice. And I continue to draw strength from knowing that these people here and 300 others and many others are fighting the fight, are doing the work, are not getting caught up in all of the noise. But I also recognize that these conversations like we have today are important because we need to keep ourselves refreshed. We need to see each other's faces and connect in person and virtual ways. And we need to hear from people that are leading and doing this work and finding ways to support them. So we will continue to bring these sessions. If you have ideas or thoughts, let us know. Morgan, shout out to Morgan on our team who pulls these together and brings this community together every few months as well. So I'm excited. I had a chance to meet Omari Maynard a few months ago. Actually, someone who came to one of these events made the introduction and connected us and said, you guys, it would be great for you to talk. And I immediately was like, we got to find ways to collaborate, to connect. As you will see, was deeply inspired by Omari's leadership, his work, his strength. And this conversation is going to be really real and powerful and help us think about what do we need to do to make health care more equitable. And I'm so grateful. I'll have them introduce themselves in a second. Omari and Atnre Alleyne, who's joining us on a panelist, has spoken at the Proximity Project in our cohorts several different times as well, and founded Do Care Doula Foundation, and is doing amazing work on this very topic we're focusing on today. And similar to Omari, they both, I don't know how they get it all done and what they do, but I think it's important for everyone to hear from them and like what the lessons that we can take. So I will start with some questions, but I want to quickly turn to all of you. So raise your Zoom hand, drop your questions in the chat. You can private message them to me or Morgan as well if you prefer that way. So let's jump right in. Can maybe Omar, if you want to start, and then Erica, just introducing yourself to the group, your story, your why. I want to ask maybe before Omari goes, can you show of hands if you've seen the documentary Aftershock? Raise your Zoom hand if you've seen Aftershock, so you can see all Omari who has seen it yet, who's going to see it immediately after this, hopefully. So we got raise your Zoom hand, a few so far. Okay, so hopefully many more of you see that documentary, and you're going to get the preview and the urgency as you hear Omari right now and Eric as well. So Omari.
All right, thank you for the alley-oop. My name is Omari Maynard. I am the co-founder of the ARIA Foundation. ARIA stands for the Advancement of Reproductive Innovation through Artistry and Healing. I am the son of Elton and Dolores, and I am the father of Kari, Anari, and Uriah. I came into this work, and I'll keep it brief. I came into this work through way of Shamani Gibson. Shamani was my life partner. She passed away in 2019, giving birth to our second child, giving birth to Kari 13 days after delivery. She passed from a pulmonary embolism. As we have this conversation, I'm sure I'll get more in depth into how it all happened, but transpired. But long story short, Shamani specifically and her mother, Shawnee Gibson, have been in this work, this maternal health space, for over 2 decades, So as soon as she had those signs and symptoms, we knew she could be possibly having a blood clot. Let the doctors know, let the hospital know many, many times over. And unfortunately, she was not heard. We were not heard. And like I said, 13 days later, she passed away. So now I've been charged over these last 5 years in order to make sure that we not just only celebrate Shamani, but we also celebrate all the Shamanis who have transitioned from maternal mortality, who have suffered maternal morbidity. And we do it in a way that allows community to be represented properly, be represented fully, and get into spaces and places where we are not represented and not heard. And I'm complete.
Thank you, Omari, for sharing that, and we'll definitely have a chance to dig more into that topic. And thank you, Erica.
Hello, everyone. My name is Atnre Alleyne. I'm the executive director and founder of Do Care Doula Foundation. My why is because there's a need. Within our community, there's so many limited resources, education, and just support in general. I am a mother of 4, so I've been, experienced 4 births, and all of them, there were some complications throughout pregnancies and delivery and whatnot. So love the work that I do, and I'm here because there is a need.
Thank you, Omari. Maybe you have more. Y'all have time, right? We created time. If Omari, you want to share more about from that really tragic moment, how you got here, and talk more about the work you're doing. I'll have questions later, just around the strength part, right? Around this, right? The strength to be on these panels regularly, to be telling this story, to doing the work. But if you can kind of maybe take the others here through the journey of from that moment to deciding to start doing advocacy, doing work to heal others.
Yeah, no problem. So, to take it further back, this work, like as I've learned myself and have been, kind of thrusted into an experience that I did not want and into a space where I didn't necessarily think I was going to be or even really wanted to be, and to be totally honest. I know it stemmed from my mother. My mother is a teacher. My dad, he works with the Department of Corrections in New York City. He creates programs, rehabilitation programs for inmates getting back into society. So, always challenging me, always making me think, always asking me questions that he knew I did not know the goddamn answer to, but made sure that, he knew and had my mind always thinking. And my mom, she's a honestly, she's like a celebrity, in Brooklyn, New York, and she's taught at a school called PS 208, and was just always deeply ingrained and rooted in the not just the culture, but the want to make sure that Black kids specifically knew who they were and understood the importance of education, understood the importance of knowledge, understood the importance of sharing knowledge, acquiring knowledge, and just trying to be the most powerful and effective person for their society as they could be. So these are the parents that raised me. My mom had me watching Like It Is and Sunday Morning. I swear I felt like it was every weekend. And those, images of, Stokely Carmichael and Malcolm X and Martin Luther King and civil rights movements and things of that nature have just always been a part of my life since I can remember. So as I, matriculated through school, I graduated from high school, graduated from college, got 2 master's degrees, ended up getting a 3rd master's degree in education. And found myself teaching, and at that point, teaching is great. I love students. I knew it wasn't necessarily, I can't say I knew it wasn't necessarily where I wanted to be. Now I can say that. But I knew that I wanted to be in a space where I could give back, and help support and do those things. And then, like I said, I met a beautiful woman. We had beautiful babies together, and then, she transitioned. And honestly, like I wanted to keep teaching, but I couldn't. I just couldn't afford it. Like there was no way where I could be able to go to work and take care of these 2 children and grieve and do all the things that I needed to do, So ended up quitting my job, and really thankfully, because of time and paid leave off and just saving and stuff like that, and more specifically and more importantly, the community and the community support that I had, I was able to take a couple of months off, not a couple, 10 months basically, off, and really sit in my grief, sit in my thoughts, sit in loss, sit in what actually happened and what can possibly be done. After she passed away, I started really doing research around what maternal mortality was and the history of healthcare in the United States, and what the trajectory of Black and brown women have been in terms of, passing away during childbirth. I just knew that there was some men's group somewhere that they were doing this thing, that they were advocating for their partner and creating change and shifting and things of that nature. And come to find out very quickly that there really wasn't, there. But thankfully, social media is a blessing and it's a curse. In my instance, or in that case, for me, in that time frame, it was a blessing. There were men who reached out to me who had lost their partners the same way. Two men specifically, Charles Johnson and Mustafa Shabazz, reached out to me, and that really opened up my world in terms of knowing that there were men out there who were advocating, but also knowing that I had somebody who I can ask the really hard questions to. The questions that I couldn't ask my mother, I couldn't talk to my brother, couldn't ask my best friend. The dark places that I was in, the suicidal thoughts that I was having, all these things, that I knew I could lean on them because of the fact that I knew that they knew where I was coming from, and I wouldn't be judged for it. And in those conversations, I really learned a lot about the power of community. I learned about the power of brotherhood. I learned about the power and strength of being vulnerable, um, and all the things that came with that. So I knew that for me, after really building these bonds with these men very quickly, in a very short amount of time, I wanted to pay that forward, and a couple months after, a brother, his name is Bruce McIntyre, lost his partner, Amber Isaac. And same, people started hitting me up on social media and letting me know that, this brother lost his partner. And I reached out to Bruce, and me and Bruce, first night, we probably sat on the phone for about a solid 3 hours and was just chopping it up, and he had the same, mind frame as I did. And, we just really built this bond, and as this is happening, this is very this so rewind a little bit. Shamani passed away October 6th, 2019. I celebrated my birthday on October 11th, 2019, and the only date that we could even do the funeral on was October 11th. So I ended up having to bury Shamani on my birthday. I was talking to Bruce, having a conversation with him that same night, and come to find out he had to bury Amber on his birthday as well. So once we kind of found out that we had all these, aligned experiences together, we pretty much knew that what we had to do, and that even though we didn't necessarily want to be in this space and didn't want to suffer this loss, we understood and didn't know where we were going with this. We understood that there was a bigger picture here. There was a bigger thing happening that that we needed to make sure that we answered the call for and that we were a part of. So at this time, Shamani's birthday is on December 19th. And so between that 2-month period, we wanted Shamani's mother, Shawnee Gibson, and I wanted to put an event together for the community. And the event was called Aftershock, so that we can talk about what happened to Shamani, so that we can celebrate her birthday. But more importantly, so that we can bring the community together in a fashion in which celebrated art, celebrated culture, movement, dance, panel discussions, so that we can raise awareness around the maternal health crisis. And a young lady, her name is Paula Eisel, who ended up being the producer and director of Aftershock, the film, came and was like, I just want to record y'all and see what y'all doing because I'm thinking about making this film. And she came and she was blown away. She saw what we were doing. She understood our mission, and she was like, "Yo, I want to create a documentary around your story," And at the time, I was like, "Hell no, hell no." And I was saying hell no because, like, again, this is 2 months into me losing Shamani. I'm like, "Yo, you can't get no lower than me right now. Nobody can, so there's no way I could have somebody, filming me on an everyday basis, but having conversations with Shawnee, and, she was a resounding yes, and listening, and the reasons why she was a yes is, one, because again, this is bigger than us, two, our story could possibly help people, but if it didn't do anything, this was something that we can have documented for Atnre and Kari, Shamani's, son and daughter, to have, so that they can know who their mother was. So I said yes. You know, they filmed us for about a solid year and a half, almost 2 years. Um, and the film came out, and it did great things. It's continuing to do great things and open up a lot of doors for us in terms of this advocacy work and making sure that and learning the power of art, the power and the revolutionary act of creating, and how you can touch so many lives, through art and different types of artistic modalities. I paint. I'm a painter. So through portraits, through painting, through movement, through dance, through conversation, through performance, through psychodrama, so many different things that we do as a family, that were highlighted in the film and that we use to, create these type of conversations today. Um, it was all in the film, and the film, thankfully, it won a Peabody Award. We were Emmy nominated. We won. We were in hundreds of different film festivals over the last couple of years, and it opened up a lot of doors for us to have conversations around this work, but more specifically to get men, involved in this maternal health conversation, which is something that wasn't necessarily happening at the rate as it should have been happening. When somebody passes away, there's a partner that's left behind, and it's so important. And I've learned that, just through having conversations with so many men, that having the bandwidth to do what we do is not necessarily the case. And thankfully for me, I had time, I had presence, and I had community to help support me in this mission, and other people, they just don't have that, so I know that for me, being able to be an advocate and then also being somebody who has shared his most vulnerable moments, um, help create space for men to be a part of this conversation and just learn more about the maternal health crisis, and understanding that we have a position and a need and a place to make sure that we are not only in the know of what's the worst things that can happen, but more importantly, understanding the great things that happen in childbirth and the need to be there for the family, but also the presence of mind and knowing that if something does go wrong, there are actions that you can take, in order to help and support your family, support your partner, support your community, and support yourself. And I'll pause there. Yeah.
Thank you so much. I'm gonna ask a question to Erica, and I'm probably gonna open it up because I know that people have a lot of questions. Some already coming over to me. Erica, if you can talk about, I would love you to talk about your work. And I think one of the things I want to say beforehand is that I heard in the documentary Aftershock several times, right? This is preventable, right? Talking about kind of individual loss, right? But then also just overall, a lot of times people kind of wring their hands in the healthcare system and they're like, what do we do about this, right? But we have history, right, of what works, and the present day of what works to prevent this, right? To support and Erica, you're doing that work. So if you can share, like, what are you doing? What are you finding that's working? And if you also want to share what challenges you're encountering in doing that work.
Sure. So what we initially started out doing at Do Care Doula Foundation in 2021 was training Black women to be doulas, doulas being non-medical support people. One of the barriers I ran into when I was training to become a doula was finances. Um, it was very cost prohibitive, the things that were needed, like the training, the books, the other educational pieces. So we came in with the idea to kind of bridge that financial gap and be a support for those who were looking to provide the doula support. We also began providing free doula support to the Black community, so there wasn't that cost barrier there. And then we also expanded into community outreach. So as doulas, we're there to support, but we also realize that a lot of our birthing people experience different needs, from housing to food to diapers to different things. So um, last year, we were actually able to open a community resource center where we have a food bank, food and basic needs pantry, diaper bank. We teach childbirth and lactation education. We have fitness classes, support groups for postpartum moms, and also a pregnancy and infant loss group. And then we're still doing our doula training. We're not doing the free doula support pieces because we haven't been able to get that funded due to some of the different legislation with Medicaid reimbursement and whatnot within the state. But we are, still actively doing the work. And again, one of our biggest issues is funding, limited funding availability.
I know what that looks like. I want to bring up to both of you, and then y'all raise your Zoom hand, drop your questions because I want to turn to your questions. If you could talk about what do you want to see more from the people working within the system, right? You're working on the outside of the system. You're doing advocacy. You're providing things to the community, and you have a lot of people here who are working either at hospital, healthcare institutions. They're kind of working within the system, and we need both, right? Doing this work. So maybe Omari, if you wanted to start there, and then Erica, what have people have Omari have who's worked with you, who's collaborated with you? Has that not been what you as much as you want? Like, can you speak to that? And the same thing for Erica.
Yeah, definitely. What I would love to happen, which I know probably will never, is the acceptance and clear saying that midwifery care was taken out of the Black and brown woman's hands, and put into the hospital system, and it's just never served us since. I won't wait too long for that to happen, but in the meantime, between time, what I would love to happen is more integration of midwifery and doulaship care within the hospital system. Outside of that, having people understand and knowing that they have birthing options. I think that I just know that the marketing and branding of child delivery and delivering babies in hospitals has just been so ingrained, and especially my generation and previous, that's the only place and it's the only way it can happen, and it's the safest place, right? And I mean, obviously the numbers show that it's not. The numbers show that the more support you have, the better outcomes you have. The numbers show that holistic care is if not just as important, more important, than medical care. And understanding that, for generations upon generations upon generations, that holistic care has been what's brought so many of our family members earthside, regardless. And that care has been at the hands of mainly Black and brown women, and again, like I said, I touched upon birthing options, making sure that people know that, if you want to have a birth, if you want to birth in a hospital, that's great. Just make sure you have a birthing plan. You make sure that you have the support. But you can birth at home. You can birth with the midwife and doula and a doctor at the hospital. You can birth with the midwife and doula and the doctor at home. You can go to a birthing center. There are so many things that you can do. When it comes to having birthing options, but Erica touched on it a little bit in terms of having the financial support in order to do those, in order to exercise those options, and those are more importantly the things that I wish would happen is that there's more financial support for people to get individualized care, and we all see what's been going on over these last couple of weeks, months, in terms of this new regime changing and shifting so many things, which has been horrific. But I think the silver lining, what will come out of it, is that people will have a better understanding of the importance and need of individualized care. Because at this point, there is no sugarcoating on who's being helped, who's not, who's being supported, and who won't, So it's more than anything up to us, to be able to make sure that that people do have the ability to and the support more than anything. And the knowing that they do have people who do know what they're doing, who can do the same thing that anybody else can, and just getting the knowledge and information that they need in order to get the things that they do need.
Thank you, Erica. Same question about partnerships with the healthcare institutions, the healthcare system, how that's been going, what you want to see more from people, some people that are here, and other people they can kind of advocate to and talk to.
Definitely more unity, togetherness, and acceptance on both ends. With the hospital systems, we talk, some are more receptive than others. But I think that there needs to be open dialogue, and there should be less hierarchy, if I'm saying it right. Um, I feel like sometimes, you know, people think that they're above other people. So sometimes that can disrupt the conversations that need to flow. Also, there's some stereotypes and bias involved. So before we even meet and get to the door, like there's assumptions and things that it just doesn't, it's not supportive. And then overall, I will say this in the world of birth work, Black birth workers specifically, unity, togetherness, and acceptance. There's a lot of competition and mindset that isn't beneficial to birthing people and the work that needs to be done. We can all be seen, we can all be heard, we can all do the work. We have to remember it's not about us individually, but it's about the community that we serve, and we need to lift each other up and have more togetherness because we're stronger together. There are some people that may not be a good fit, for me to support as a doula, and vice versa. Or I may need to recommend somebody to somebody. So it's good to have that unity and togetherness and not that competitive mindset. That makes sense.
Thank you so much. All right, keep the guys' questions, drop them in the chat, or you can also raise your Zoom hand or ask, drop a message to us. Michelle, we've been patiently waiting. Please,
Um,
please introduce yourself.
Hi,
Another person leading in this work as well.
greetings, everyone. My name is Michelle Drew. I'm a certified nurse midwife, and I have been a nurse midwife for coming up on 26 years now, and a nurse for 36. And so far, I've caught 3,000 babies and counting. I'm also the executive director of the Ubuntu Black Family Wellness Collective, which was designed to be a space where um, um, people and families, but yes, or Black women could come together to kind of reform the safety net that Black birth workers, played in the community historically. That's been taken away. Omari, I just want to say how much I admire you and know of your work, and really to validate a lot of the things that you said. We are it's 2025. So 100 years ago in 1925 was the year that the federal government and every state in the United States started regulating midwifery. At that point, there were over 100,000 midwives in the United States that attended 50% of the births, and 90% of those midwives were Black women. And, the way that they were able to, systematically eliminate a workforce while, convincing people that, the best place for them is the hospital, which, wasn't true, was by blaming health disparities on Black women. And so when we're thinking about today, now that we have, modern formal education programs, we think of, what I think that of the experiences that I have, both as a Black midwife who's delivered babies both in the hospital and outside the hospital, is that the healthcare system and people within the healthcare system with the power to do so, most of whom would be racialized as white, and many of whom would be men, need to speak up and validate what we're hearing from people like our young brother Omari and the experiences that they have. And then also recognize that midwifery is the default. The United States and Canada, which mimics our medical education system, are the only developed countries that have more OBGYNs than midwives. We're the only country that does not use midwives as the primary caregiver of women and people capable of pregnancy for all of their life, regardless, not just when they're pregnant. We're the only country where the majority of births aren't attended by midwives. And that happens because health systems, hospitals, and organizations like the AMA, the American College of Obstetricians and Gynecologists, and even to a certain extent, the American Nurses Association, have never supported midwifery. So like in New York, where Omari lives, certified professional midwives cannot practice because other midwives who are a 90% white workforce have actually traditionally lobbied against them. And in the state of Delaware, where until a few months ago, I was the only Black midwife doing home births, we've had a law on the books that guaranteed women access to home birth for 7 years. But the state of Delaware, every insurance company in the state of Delaware, including state-funded insurance, does not reimburse people for home birth. So either I have to give away my services, people have to hustle to try to find that money, or we have to rely on funding. But if it's not there, what are we doing? We are forcing Black women to go into a health system that was built on our backs, and then disempowering their partners, because it's like, if you talk too much, you're the angry Black man. If you do the wrong thing, they can have you ejected. And then, so how do we do that? Is really just by looking internally into the health system, and actually saying, we need to actively break down the barriers that allow midwives to practice in the hospital, and making sure that we have payment options outside, but making sure also, most importantly, that every person going into the health system knows their rights, and they should be told their rights by the health system. Like, did you know that you don't have to agree to have a medical student and a first-year intern who just graduated from medical school managing your healthcare? A lot of people don't. And it's costing women their lives, it's costing Black fathers their partners, and it's costing Black children their mothers, and it's really destroying the Black family.
Thank you so much. As always, dropping so many facts here. Omari, do you want to respond to anything you heard there? And then Gemma, I'll go to your question.
Yeah, I mean, most definitely. Thank you, Michelle, for all the insight. It just makes me think of the parallels between the education system and the healthcare system. We were born into this space where we see the need and want to help, and being put into these systems, we have the best intentions. And like I'm saying this because, like the education system, nurses, doctors, at least the ones that I've been present and privy to, for the most part, I've always had good experiences in terms of, especially when it's a Black or a Black nurse or a doctor, or a nurse of color, and a doctor of color. Really good interactions. But I think about, and I say the parallels because I think about the education system where we're overworked, we're underpaid, we're doing 100 too many things to just try to make things, to try to keep the bills paid, and I know for nurses and doctors specifically, like doing doubles, having overtime shifts, people are just so overworked that it makes it hard to do the job properly, even if one, and then also two, like especially the hospital that they ended up taking Shamani to, it was underfunded. It was divested from for years. Like they had no money in that hospital, so, and nobody went there because they knew they couldn't get the services and the care that they wanted. I don't care how great the doctor was or how nice the nurse was, they couldn't do anything because there was no money there. So it's so important that, in addition to all the things that are said, that, money is dispersed equitably, and in the places where the need is the most, and again, because there's so many different systems that are in place, now we're getting into redlining and the difference between, neighborhood and division and all the things that happen with that. It's a sad situation that, this is not just a systemic issue, but this is an issue that has been very strategically placed, and unfortunately, we all have to suffer the repercussions of it. So with that said, it's just so more important and so much prevalent, especially nowadays and now in times, that, community gets together to help support each other, and the people who have the education provide the services. And I know, like Michelle, nobody wants to do work for free. I don't want to say I hate. I don't want to give away my artwork for free. I need to get paid too. Just like you don't want to give your services away, you need to get paid. but at the same time, sometimes there's bigger needs um, there's bigger purposes, and unfortunately, we with all the other things that Black and brown people have to put on their backs, that's one extra thing that, sometimes we just have to add to the plate, because it's for the greater good of the community.
Absolutely. That's why I want to honor, I in the past 12 months, I've been fully compensated for one birth. And I've never turned anybody away because they can't pay. Just like, if it is it's our craft, it's our vocation, but it's, it's our birthright, just like your art, and the work that you're doing to help people heal through what you're doing. So I just really thank you for that.
Thanks so much, Michelle. Gemma.
Yeah. Number one, can you hear me? This microphone is acting crazy. All right, perfect. Thank you. Number one, thank you so much. Aftershock was shocking. It was really, if anybody hasn't seen it, please see it, but be prepared when you see it because it is very raw, very real. But I wanted to throw out something that's probably not going to be hugely well received, but I think we have to remember that part of the systemic problem is that training that's happening for our OBGYN and physicians is based on all of this historical data that's been manipulated to serve a certain purpose. So some of us have had, unfortunately, really horrible experiences with Black doctors. So I think we have to also be careful with saying that a Black and brown doctor means it's going to be better, because a lot of times it's not, which is a double sword. You're expecting that you're going to get better because we've all been told that it, definitely go towards a Black and brown doc, but a lot of those docs have had it's the same base training. It's the same faulty information. So sometimes you end up fighting even another battle when you go into some of this care. So just something, push back on your doctor, period. I've been in the health system. I've also been a labor coach for 30 years. And sometimes that's nice because I can take on the fight the family can't and push back. But I love, Michelle, what you said, and Erica, what you guys said about, these guys work for you. At the end of the day, it's your insurance that's paying it. It doesn't feel great, but you can fire a doctor. You can escalate. You can get advocates. Everybody doesn't know or even believe they can do that. But part of your birth plan should be learning as much as you can about the escalation chain at your hospital, who it is that you can contact if something goes wrong. If you can't, some people are high risk, they can't do the birth center, they can't do it at home, they have no choice but to go into the hospital. And sometimes that complicates it even worse. So I applaud all of you guys in this field. I wish, and I guess maybe a question for you guys, what do you want us to do? People that are boots on the ground that are interested, what's the fight that we can help you fight? And I'd ask Omari and Erica that same question.
Hey, Erica, you can start, and then Omari. Thank you, Gemma.
Advocacy and awareness. Those are things that can help, like talking. It sounds minimal, but spreading awareness, because you'd be surprised. Like, so many people are like, that's not a thing. It's been all over the news. I don't know where people are at, but like, so definitely talking, spreading the word, and helping people get educated. Even when your loved ones are pregnant, like, talk to them, like, where are you going to have your baby at? A lot of people just go to the hospital, like they don't know their rights and the things that are available to them. So definitely talk and spreading awareness.
Yeah, thank you for that, Gemma. You're absolutely right. Your care is based off of your heart, right? And your mind, and who you have aligns with that, regardless of skin color, is the most important thing. You're absolutely right. And to Erica's point, definitely advocacy. I know that for us, we're working on many different projects, but one specifically is two specifically is Speak, Move, Change and Postpartum Awareness Week. So Speak, Move, Change is it's actually a global entity that we've created in order to bring people together who are in this work to create a week-long virtual series around, and bringing activists, bringing artists, bringing talking heads, bringing people who not talking heads, excuse me, but people who are experts in their fields, to have deeper conversations and broader conversations so that people can be educated and learn. And then Postpartum Awareness Week is a week that the ARIA Foundation started. Postpartum Awareness Week happens the week leading up to Mother's Day. And it's also a virtual series that we do to talk about everything postpartum, because, you know, that's where we're losing most of our women during that time frame. So again, bringing advocates, activists, experts together to, you know, enlighten the community, but more than anything, to make this community a lot smaller. We're all doing great work in all different parts of the country, you know, but when we're able to create spaces like that can, so now I have specific and personal connections, you know, and creating personal connections with people around the world, you know, it helps in terms of getting the things that we all need. Yeah.
Thank you. One of the things that I want to say, I have a follow-up question, and we'll go to Adrian. I'm going to go to your question in a second. But I would encourage, we're going to do that as the Proximity Project, but I would encourage also people here who can to make donations to their organizations. Hopefully Morgan will drop links, or you guys can drop links there. I was in, last year I was in Minneapolis for the Grantmakers for Education conference, and you know, there's a bunch of big funders there. And one of the nights we went to the George Floyd Memorial, and people were kind of touring us around. And similar to what you're hearing from Omari, and Atnre Alleyne was a grassroots leader who was speaking to us on a panel, then took us through Memorial, and we were kind of doing this pilgrimage. And then I was walking as a person who's been there. I was like, "How are you paying for your work? Where's your funding?" And she's like, "Oh, you know, it doesn't have the resources, right?" Here you have all these funders there coming and learning, and I'm like, right? Like, how many people actually, you know, made a donation to her and her organization before? So I would highly encourage you to do that. Tell other people to do that as well, because a lot of times we're on these things and you're doing this work, and it shouldn't be, as Michelle says, Omari said, like, it shouldn't be, you know, where you have to pay out of your own pocket, right, and not be able to have what you need for yourself. So I want to say that before I ask a question. The follow on, and then I want to go to Adrian's question, was to what Gemma said. For Erica and Omari, what do you feel like should be in the canon for healthcare leaders, healthcare professionals? You know, what kind of things have you read or seen, experiences, podcasts, people they should be plugging into to kind of reorient, right? What would the curriculum look like if you had an ability to shape it?
Mm-hmm. You want to go first, Erica?
Sure. I've been talking about this for a few years now. I'm a licensed practical nurse, so I went through nursing school. I graduated in 2017. Some of the bias that are in the book still, 2017. The Black woman is the center of the, you know, Black families. We don't eat healthy. The dads are incarcerated. Like, these are literally inside of textbooks. So there was a lot of uproar in my class because we were predominantly Black. But imagine people who have these textbooks that have no experience with Black people whatsoever. What do they believe? What they read in that book, right? So bias training that is developed and executed by us. Also, if you're in healthcare, like teach back, if you will. So training and then go around, like I've literally, when I was in midwifery school, my preceptor was Caucasian, but we would have long talks while we were traveling to our different births or prenatal appointments about what was needed. We need to actually do, like, I don't know what you call them, case studies, but interactive, where everybody has to go through the different case studies and answer specific questions on their thoughts to see if what they learned actually sinks in, or if they're still operating off of bias. So long story short, bias training, starting at the educational piece of healthcare providers, and ongoing continuous education has to be a must. And again, the people that are leading need to be people of color, and it needs to be intentional.
I love that. Thank you so much. And for people who are in the kind of continuous kind of learning, professional development in the system. So if you have, for your teams, bring case studies. I do this. I've done this for many years. Bring case studies and talk about them, and kind of you'll see a lot of these mindsets come out, right? And we do this in the Proximity Project, right? Dig into a case study. How would you respond to that? So I think those are things that you can also, everyone can bring into your teams, but obviously before people get into the profession, it would help. Omari?
Yeah, so we're working on creating a curriculum around Aftershock, and I feel like it's so important that medical students, people who are in the profession or going into the profession or have just been there, they see the film. Because I feel like it will help with a lot of what Erica just talked about in terms of understanding more deeply the impact that happens when these biases, these issues come into play, in real time, and seeing it firsthand. That's one. Also, too, I feel like it's, just from an ARIA standpoint, the understanding the importance of the intersection of art. What I've learned being able to go around and speak to so many people and seeing hospitals and seeing offices that the power of art, right? The power of going into a birth center, the power of going into a hospital and seeing a picture of somebody that looks like you, it allows and creates space for you to, one, feel more welcome, but also two, for the people who are providing the services to you, understand that that they are there for you, So I think that a lot of the time, sometimes the pictures don't match the institutions, or the institutions don't match what the services that they need or the community that they're serving, so and I feel like, I mean, I know that art in itself has the power to help bridge those gaps. We do a thing called psychodrama, and I feel like everybody and their mother needs to be a part of a psychodrama experience in which it's essentially you having conversations with yourself that is being um what's the word I'm looking for, facilitated by a professional, who is by a psychodrama professional. There are so many ingrained biases, ingrained traumas that we all just push down so far, but it always come up in some way, shape, or form. So it's essentially this kind of therapeutic experience where you are training yourself to know that I have biases just like everybody else does. Nobody's perfect. Nobody's is the nobody's perfect, right? So it's so important that we do our own personal work, our own inner, what's the word I'm looking for? Shadow work, before we even start helping other people, because like I said, we bring so many of our, inequities and our shortcomings to situations that don't need to be there, so I think that those are what I would bring. Yeah.
Thank you so much, Adrian.
Well, first and foremost, good afternoon, everyone, and thank you. Omari, thank you very much for sharing your story. And Erica, thank you for sharing your time, your work, your efforts, your purpose, and what it is that you're doing. Erica pretty much hit the hammer on the nail, as we are, we're told by Michelle that, maybe we should opt out on having specific people in the room to either operate on us or to provide care. But I do believe that everybody has to eventually gain their experience. This is why you have to start from the foundation. And that is the books that are being read, the textbooks that are being written. I've been in pretty much every single part of healthcare that you could probably name in regards to topics. But I will say this is, the biases are real. The conditioning is real, especially from the professors. But if the professors can't teach those things from the book because it's not there, then they have to teach from what's in the book that actually is there. So I would then even just go back to the authors who are writing these books, and even the artists who are drawing the body parts within the books, and also, addressing those things so that the professors don't have any other choice but to teach that, because that is again, they're providing a service and providing the teaching. So if that's what I have to teach from, I have no other choice but to then, draw out that and eliminate the conversation so that everybody is conditioned to be able to have both equality and equity within the services that they provide. Another thing is I'm going to also go into not only the academic setting, but also the insurance setting. I've worked in, again, many different locations where when I'm filling out for my health insurance, I'm finding that pregnancy is deemed as a disability still. And I've worked for healthcare organizations, and I've worked for insurance companies, I've worked for pharmaceutical companies. And every time I go back to my HR representative, I challenge them with it, not to be a nuisance again, but to just say, if it's a disability, why am I not receiving an extra check for the disability in the case that, that I actually do get pregnant or do experience any type of have any type of maternity experience? And the HR person can never answer the question. So then it goes back to the contracts that we have with the insurance companies that are facilitating insurance, not only within the state, but also for those who are actually working in specific industries. And so it is a system, it is an institutional and a systematic problem that I think that we should address, but we should also challenge those who are writing up the paperwork. And that's from a policy standpoint, a legal standpoint, and an academic standpoint. Thank you very much.
Thank you so much. Thank you. I have a final question, and then I have a giveaway. Morgan had to drop off, but he did a random drawing, and I'll share in a moment for those who hang out who got the who got the good. So my last question for Omari and for Atnre Alleyne is, I know a lot of people right now, given the climate, given the opposition, given the outright attacks, there are people that are retreating, that are afraid, that are allies, but they're losing steam. And you, Omari, and you, Atnre, have persisted through pain, through challenges, through lack of funding, all these things, lack of maybe team. What's your word for the group to how to keep persisting in this work, how to adapt, right, to the different things that are going on? Because I think that requires more experience in movement building, in kind of social justice and racial justice. So final question for you.
Yeah, definitely. So I know for me, it's there's many things, but community support, like you have to have a foundation, you have to have a team. You cannot do anything without a team. During my darkest times, during my deepest grief, it was the outlets, so having art, was something that, was really powerful for me, because I was able to speak to a part of myself that I didn't have the verbal language for, but the spiritual and emotional connection with creating artwork and sitting with myself allowed me to process things that I wouldn't have been able to have processed trying to talk it out with somebody. The next is for me was working out, and I was doing a lot of running, and I'm always working out more so than anything to just get the energy off of me and out, in a positive way. And I really see physical strength being very much aligned with mental and spiritual strength. So the more I work my body out, the more my mind grows, the more my spiritual connection grows, and it's all transferable. So when the weight is too heavy, I know mentally I can do it, because even though my body's telling me I can't do it, my mind can tell me that I can. And it's the same thing with this work, right? There are so many days where it's like, man, I don't got it today, but I know that if I just take one more step forward, then it'll be okay. You can't have 100% all the time, but I can do 100. I can, with my 20%, I could put 100% into the 20% that I may have that day. And then lastly is you just eat the elephant one bite at a time. It's a lot, man. I tried my best to turn the TV off or get off of social media, because there's just so much going on, so many things to have to fight. But I know that if I just focus on my lane, that I can do the best in that space and pray and know that somebody else is doing the same thing in the lane that also needs to be addressed, so just do what you can, man. And this is what we need, being able to share space, and have those conversations in spaces where we can emote, and we can be and see people who are also in the work to know that, all right, it's not just me. I know somebody's doing the thing. I know Tina's over here doing the thing, and Chris is over here doing the thing, and Ham's over here doing the thing. So I can do my thing, and with that, I'm complete.
I love it. I love it. I know Erica had to jump, but she shared in the chat that for her, she was feeling really discouraged. She was worried about continuing, and she had to regroup and remember to rely on faith. God is in control at the end of the day, and this too shall pass. Thank you all for listening. And Omari, thank you for the work that you do. So I want to join her in thanking Omari, and just thank also Erica, and give them some love in the chat, some fire emojis, whatever it is that you do. And please, if Omari, I dropped the link early in the chat, but please try to plug into their work, see ways that you can support them, connect, collaborate, bring Omari to your institutions to connect. And I loved hearing Omari about the kind of curriculum that is in development. So thank you to you. For everyone else, for anyone who doesn't know, we are recruiting for our next cohort of the Proximity Project, which will start in a few weeks. And we're going through conversations like this for 8 weeks, going deep, really thinking about how we can do this work at another level, how we can sustain this work as well. So we'll have a cohort in a few weeks, and then we have a cohort as always in the fall. So you can learn more at theproximitypro.com/healthcare. But thank you for joining this conversation, and we look forward to having another one of these soon. I saw a comment that we need to have a part 2. So I'll take that to Morgan. So thank you, Omari.